Hello, my name is Amit Basole. I am Associate Professor of Economics at Azim Premji University, where I also head the Center for Sustainable Employment. In this video, I would like to tell you about the main findings in our new report, State of Working India 2021, 1 year of COVID-19. This report analyzes the impact of the COVID-19 pandemic on income, employment, poverty and inequality in India. It also analyzes the policy support measures taken so far and proposes some measures for the road ahead. As India struggles with the second wave, far more deadly than the first wave, and possibly prepares for a third wave of the virus, it is urgent that we learn lessons from what worked and what did not in the year 2020, and what were the exact nature of impact, particularly on vulnerable households in the country. What we find in our report is that as a result of the national lockdown and then subsequently a continuation of the depressed economic circumstances, poor households have suffered greatly in terms of loss of jobs, loss of incomes, indebtedness, decreased food intake, and other undesirable effects. In the figure that is coming up on your screen now, you will see that relative to their pre-pandemic income level, the poorest 10-20% of households lost their entire incomes for the months of April and May due to the lockdown. And even in June, they earned less than half of what they were earning in a typical month in the pre-pandemic period. As compared to the poorest 10 or 20%, the richest suffered much less in proportionate terms. Again, you will see on the graph that the richest 10% at the right-hand side faced a decline in income relative to pre-pandemic levels of less than 25% compared to 100% for the poorest 10 or 20%. So in all, what this tells us is that the income shock was borne disproportionately by the poorer households. As a result of this, what has happened is that income poverty has dramatically increased. We measure poverty by taking a threshold of rupees 375 per person in the rural areas and rupees 430 per person per day in the urban areas. These thresholds come from the Anup Satpathy Committee recommendations of the National Floor Minimum Wage. We estimate the percentage of individuals who live in households that earn less than this threshold, pre-pandemic and during the pandemic. What we find is that the poverty rate shot up from around 25% in rural areas to 40% and around 15% in urban areas to 35%. In the figure, you will see that there are two sets of bars. There is a set of bars that tells us what would have happened had the pandemic not occurred. Poverty would have declined. On the other hand, what actually happened as a result of the pandemic is that the poverty rate shot up. In absolute terms, these rates translate to an additional 230 million individuals in poverty as a result of the pandemic. The figure that is coming up now will show you the absolute number of individuals in millions in both rural and urban areas. What does this mean? This means that as a result of the income losses and employment losses, and despite the fact that households have managed to cope as much as they could by falling back on agriculture and other fallback options, the economy has experienced huge losses of income which have been borne primarily by those who are least in a position to bear these shocks. What should we do going ahead? It is imperative to bring back some of the measures that have been tried last year. For example, the expanded rations made available through the public distribution system have been brought back for the months of May and June. It is necessary that they be extended beyond June all the way at least to the end of 2021. It is also imperative that another round of cash transfers be undertaken. So far, the cash transfers undertaken at the central level have been far from adequate given how much incomes have been lost. We estimate that the poorest 10% lost about 15,700 rupees of income as a result of the lockdown. To compensate for that, cash transfers of a minimum of 5,000 rupees per month for 3 months, which is 15,000 rupees total, should be undertaken now. In addition, the Narega allocation has been brought back in the current budget to the pre-pandemic level. This is not adequate given the current second wave, given that reverse migration will occur, and given that the demand for NREGA work will increase in the coming months. So the NREGA allocation needs to be brought back up at least to 1 lakh crores, which was what it was expanded to last year, but ideally to at least 1.75 lakh crores, which will give us enough room not only to give work to people who are demanding it, but also to increase the level of NREGA wages to the state agricultural minimum wage level. In addition to these measures, cash transfers, expanded NREGA, and so forth, we recommend that a pilot urban employment guarantee program be tried at the national level, starting with the worst affected districts and then expanded gradually. Such a program could also be targeted towards women workers, particularly since they have been disproportionately affected during the pandemic. Lastly, but very importantly, the frontline Asha and Anganwadi workers who have been battling the pandemic at the grassroots level have to be recognized for the contribution that they have made, and we recommend a COVID hardship allowance for these workers of 30,000 rupees, 5,000 rupees for 6 months be announced. Taken together, these measures will not only help in bolstering or supporting the most vulnerable households, but also have an impact on economic growth by bringing back aggregate demand in the economy. To find out more about the other findings in the report as well as the recommendations, please visit our website csc.azimpremjiuniversity.edu.in. Thank you.